Morning to all. Today we are going to discuss about pericardial effusion. First we can see the definition of pericardial effusion. Presence of abnormal amount of fluid within the pericardial space is called pericardial effusion. Normally the pericardial space contains 15 to 50 ml of fluid. Cardiac tamponade is acute heart failure due to compression of heart by a large or rapidly developing effusion. Next, we can see the difference between normal heart as well as the heart with pericardial effusion. In the image, we can see the difference, the normal heart as well as the pericardial effusion heart. We can see the difference. Here in abnormal heart, buildup of fluid occurs mostly in the pericardial space. Next, we can see the etiology or causes of pericardial effusion. The most important causes of pericardial effusion is pericarditis, may be due to infectious or idiopathic. Idiopathic means unknown cause. Then next cause is neoplastic. It may be due to 37% of lung cancer, 22% of breast cancer, or else 17% of leukemia or lymphoma may used to cause this particular condition. Then other causes are uremia, hypothyroidism, connective tissue diseases. In post-operative conditions also this particular problem used to occur. Then others like myxedema, severe pulmonary hypertension, trauma, autoimmune disease like SLE, systemic lupus erythematosus, or else rheumatoid arthritis, sarcoidosis, ankylosing spondylitis. Then even drugs like procainamide, hydrolysin, isoniazid, phenytoin, methylsugide and anticoagulants even used to cause this particular problem. Next we can see the pathophysiology of pericardial effusion. Clinical manifestations are highly dependent on the rate of accumulation of fluid within the pericardial sac. So due to this fluid filled pericardial space, this causes increased pericardial pressure, overcomes ventricular filling pressure, causes decreased stroke volume, and this may reduce the cardiac output. Once again I am telling, due to this pericardial effusion or fluid within the pericardial space causes increased pericardial pressure that leads to overcoming of ventricular filling pressure, decrease of stroke volume, and finally this reduces the cardiac output. Next we can see the clinical manifestation. The patient used to develop chest pain that will be relieved by sitting up and leaning forward. Sometimes this will be aggravated by lying in a supine position. Patient also develop lightheadedness, syncope, palpitations, cough, dyspnea, hoarseness, anxiety, confusion, and even hiccups used to develop. Next we can see the diagnostic measures. So the most important diagnostic feature of this particular condition is Beck's triad. So three most important features are decreased pulse pressure, 3 Ds. First D is decreased pulse pressure, mostly due to hypertension, decreased muffled heart sounds, distended neck veins, mostly due to jugular venous distension. Then pulses paradoxus, pericardial friction drop, tachycardia, tachypnea, weak peripheral pulses, cyanosis, edema, Ewart sign, that is dullness to percussion beneath the angle of left scapula from compression of left lung by pericardial effusion is one of the most important sign of this pericardial effusion. In this figure, just see the Beck's triad. So Beck's triad means already I just told 3 D's, that is distended neck vein, muffled heart sound, then hypotension. Next we can see the investigations. Baseline investigations like complete blood count, electrolytes, cardiac enzymes, ESR test as well as CRP can be done as the baseline investigation. Next we can see the other investigations, pericardiosynthesis in order to this can be done as for diagnostic purpose as well as therapeutic purpose. So while you are doing this pericardiocentesis, injections can also be injected into the pericardial space for the treatment. Then pericardial fluid analysis can be done in order to find the particular condition, particular disease. Thyroid profile, rheumatoid factor, immunoglobulin complexes, anti-nuclear antibody test can also be done to find the particular problem. Chest radiography. So while you are taking the chest x-ray, we can able to see enlarged cardiac silcoty, that is a water bottle heart, and pericardial fat strip can be seen in the chest x-ray. Then CT scan and MRI also can be done to find out this particular problem. So in this image you can see water bottle configuration. So here in chest x-ray we can able to see the particular feature. Then in the echocardiography, we can able to see echo free space less than 10 millimeter. If the particular echocardiography is with less than 10 millimeter space, means it is a small pericardial effusion. Then if the echo free spaces between 10 to 20 millimeter, means it is a medium type. Then if it is more than 20 millimeter, means it is a large type of pericardial effusion. So mostly in electrocardiography, low voltage QRS complex can be identified with electrical alternance in the V3 lead. Then next in the stages of ECG evolution in acute pericarditis can be differentiated in three or four stages. In 1 to 2 weeks, in the first stage, the PR segments will be depressed, ST segment will be elevated, and T waves will be in the upright condition. 2 to 2 weeks, during the 2 to 3 weeks, PR segment as well as ST segments will be in an isoelectric, as well as T waves will be flat and upright position. Then in for about 3 to several weeks, the PR segment as well as ST segments will be in an isoelectric condition. Then T waves will be inverted. In the 4 to or several weeks onwards, PR segment and ST segments will be in isoelectric, then T waves will be in an upright position. So next we can see the management for pericardial effusion. So oxygen supplementation, you want to administer oxygen to the particular patient as the patient develops dyspnea, fluid resuscitation. Then next thing is bed rest with leg elevation, pericardiocentesis. If the patient is unstable, we want to advise for pericardiocentesis. Then drug therapy, aspirin, NSAIDs, colchicine, steroids, antibiotics like vancomycin, ceftriaxone, and ciprofloxacin can be administered. Next major management is percutaneous balloon pericardiotomy, then surgical creation of pericardial window. So these are the management measures for pericardial effusion. First is oxygen supplementation. Next we want to resuscitate the patient with the fluid, enough fluid. Then provide bed rest with the leg end elevation. Pericardiocentesis can be done if the patient is unstable. Drug therapy like aspirin or NSAIDs, colchicine, steroids, antibiotics based on the patient condition. Then procedures like percutaneous balloon pericardiotomy and surgical creation of pericardial window in order to remove excess amount of fluid from the pericardial space. So these are the procedures which we used to do for a particular patient with pericardial effusion. Then management of recurrent cardiac terminated pericardial effusion are pericardial sclerosis with tetracycline or doxycycline, cisplatin or 5-fluorouracil. Next thing is peritoneal shunt can be done in order to balance the particular fluid. Then pericardiectomy, removal of the pericardium in order to remove excess amount of fluid. So these are the things which we have discussed about pericardial effusion. Hope you understood. So pericardial effusion means excess of amount or abnormal amount of fluid within the pericardial space. That is the pericardial effusion. Hope you have understood the particular topic. Thank you.